Hello and welcome. Today we're delving into a complex and often misunderstood lung disease of pulmonary sarcoidosis. We'll explore what it is, what causes it, how it affects the body, and what can be done about it. This video provides general information and should not be considered medical advice. Always consult with a qualified healthcare professional for any health concerns. The exact cause of sarcoidosis remains a mystery. Despite extensive research, it's believed to be triggered by an immune response to an unknown substance. This substance could be an infectious agent like a bacteria or virus, or it might be an environmental factor such as mold, dust, or chemicals. The leading theory is that in genetically predisposed individuals, exposure to one of these triggers sparks an abnormal immune reaction. In sarcoidosis, the immune system goes into overdrive, causing immune cells to clump together and form granulomas. These granulomas are small, abnormal masses of inflammatory cells. In pulmonary sarcoidosis, these granulomas primarily form in the lungs, specifically in the tiny air sacs called alveoli and the tissues surrounding them. This inflammation can disrupt normal lung function, leading to stiffness, reduced lung capacity, and difficulty breathing. Over time, the granulomas can resolve, leaving behind scar tissue or fibrosis, which can further impair lung function and in severe cases lead to respiratory failure. Sarcoidosis can affect people of all ages, races, and genders, but certain groups are at higher risk. It's more common in adults between the ages of 20 and 40. In the United States, sarcoidosis is significantly more prevalent in African Americans than in Caucasians. Women are also slightly more likely to develop the condition than men. While the exact prevalence varies depending on the region and population studied, sarcoidosis is estimated to affect tens of thousands of people worldwide. The symptoms of pulmonary sarcoidosis can vary widely depending on the severity and extent of lung involvement. Many individuals with sarcoidosis experience no symptoms at all, and the condition is only discovered during routine checks. However, when symptoms do occur, they often include persistent cough, shortness of breath, wheezing, chest pain or discomfort, fatigue, and general malaise. Some people may also experience skin rashes or lesions, eye inflammation, swollen lymph nodes, or joint pain. Because these symptoms can mimic other respiratory illnesses, early diagnosis can sometimes be challenging. Diagnosing pulmonary sarcoidosis typically involves a combination of medical history, physical examination, and various diagnostic tests. A chest X-ray or CT scan of the chest is often the first step in identifying any abnormalities in the lungs, such as enlarged lymph nodes or the presence of granulomas. Pulmonary function tests can help assess lung capacity and airflow. A definitive diagnosis usually requires a biopsy of affected tissue, such as lung tissue or lymph nodes, to confirm the presence of granulomas. Other tests, such as blood tests to evaluate organ function and rule out other conditions, may also be performed. Pulmonary sarcoidosis is often classified based on the extent of lung involvement, as seen on chest X-rays. Stage 0 indicates normal chest ray. Stage 1 shows enlarged hilar lymph nodes. Stage 2 presents with enlarged hilar lymph nodes and lung infiltrates. Stage 3 displays lung infiltrates without enlarged hilar lymph nodes. And finally, Stage 4 indicates advanced fibrosis in the lungs. It's important to remember that these stages are not necessarily progressive, and an individual can remain in a particular stage, improve, or progress to a different stage over time. Treatment for pulmonary sarcoidosis aims to reduce inflammation, relieve symptoms, and prevent long-term lung damage. In many cases, especially when symptoms are mild or absent, treatment may not be necessary, and the condition is simply monitored. When treatment is required, corticosteroids, such as prednisone, are often the first-line therapy. These medications help suppress the immune system and reduce inflammation. Other immunosuppressant drugs, such as methotrexate, azathioprine, or infliximab, may be used if corticosteroids are ineffective or cause intolerable side effects. Pulmonary rehabilitation can also be beneficial in improving lung function and exercise tolerance. In severe cases, lung transplantation may be considered. Because the exact cause of sarcoidosis is unknown, there's no definitive way to prevent it. However, avoiding exposure to known environmental triggers, such as dust, chemicals, and mold, may help reduce the risk of developing the condition in susceptible individuals. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can also support overall immune function and potentially lower the risk. Early detection through regular checkups and prompt medical attention for any respiratory symptoms are also important. The prognosis for pulmonary sarcoidosis varies widely. Many individuals experience spontaneous remission, meaning the condition resolves on its own without treatment. Others may have a chronic, relapsing, remitting course, with periods of improvement followed by flare-ups. In a small percentage of cases, sarcoidosis can lead to progressive lung damage and respiratory failure. Recent research is focused on identifying biomarkers that can predict disease course and response to therapy. Additionally, studies are exploring novel therapeutic targets and strategies, such as targeted immunotherapies, to improve outcomes for patients with pulmonary sarcoidosis. Advancements in imaging techniques and minimally invasive procedures are also enhancing our ability to diagnose and monitor the condition more effectively.